goal for today really is just to get you in sort of a baseline state of relaxation. Interesting. Okay. I like to go along your natural bone structure. So if we start at the bridge of the nose and trace across the brow bone, coming down towards the temporal region and underneath the orbital socket. Encouraging movement.
Feels like little tiny feet. I don't know
Kind of, yeah.
how to explain it.
Tickle just a little bit.
It's nice though.
You gotta get up. I just came from Santa's office. He said you haven't been fitted for your mask yet. Well, I'm sorry. I know it's early, but I've been reminding you all week, and I have a patient coming in like 5 minutes, and I need to get dressed. No, I cannot meet Hannah in my Christmas pajamas. Okay, well, can you please sit up so we can go ahead and get you fitted for your Manta sleep mask? Thank you. I appreciate the cooperation. Now, I have several masks, and we're going to go ahead and get you fitted for all of them because you have quite big elf ears, and I'm honestly not sure which one's going to fit you the best. Luckily, all of the Manta sleep masks are fully adjustable, fully customizable. They even have different fabric selections, so let's go ahead and get started. Now, you do have quite a big head, I'm just saying. All right. Okay, so I think I'm gonna go ahead and measure because I'm just really not sure with like the angle here. So can you turn your head for me? Thank you so much. Well, maybe you should have thought about that the last 7 times that I was trying to remind you to get fitted for your mask before your trip. Well, you know that Santa does not allow his elves to get on the sleigh without being fitted for their Manta sleep mask. You're slightly asymmetrical, actually. Did you know that you have one ear bigger than the other? It's quite common with elves your age. Alright, so we're getting at about 9 1/4, which is only slightly above average, so not terrible. Now, I need you to tilt your head. Yes, thank you. Your eyes are also slightly off-centered. You might want to get that checked out. Okay, so I can accommodate for that. Let's go ahead and try our first one now. You guys are going to be on the go quite a bit, so I'm thinking that the Pro Mask might be a good fit for you. Now, this is the Manta Sleep Pro Mask, and the Pro Mask I think would be good for your trip because you guys are going to be in and out of chimneys. It's kind of a lot of work. So this one is very slim fitting. It doesn't take up too much room. It's not very bulky. The fabric is really lightweight, so you won't get overheated if someone accidentally leaves the fireplace on. And let's see. Yep. So I know that you like to sleep on your side, even though I told you it's bad for your back. Now, if you look at the cups here, you'll notice that there's a C-shaped eye cup, and it tapers at the end, so it won't hurt you when you're side sleeping. Now I am going to adjust the eye cups. Everything is fully customizable. I'm going to make sure that your exact measurements line up. Even your wonky left ear, everything will fit perfectly fine. Okay. All right, now it's going to go on you just like this. Nothing to be afraid of, okay? So I want you to leave your eyes open so we can make sure it's not hitting your eyelashes. That's a pretty good fit. Okay, now close your eyes. Okay, good. So did that all feel okay? Measurements, because we can adjust it again. Okay, good. All right. So I am going to send you home with the Manta Pro mask, but I also think that we should have a look at the sound mask, because honestly, that sleigh gets pretty loud, and I don't know the last time Santa had it tuned up. Okay. So, same thing. Everything is fully customizable. This one is a little more heavy duty. A couple extra layers there because we had to fit in the Bluetooth so you can listen to all your favorite Christmas music while you sleep. And let's see. I just adjust. So you are at about a 9.5. So let's bring that down. Okay. And then we'll just match it up on the other side. Okay, all right. Now, left a little bit of extra room on that left side, and same thing, I actually prefer the sound mask. This is the one that I use on a regular basis. And I'm going to go ahead and put this one on you. So again, I want you to leave your eyes open to start, okay? Don't close your eyes. Don't close your eyes. Good. Okay. Yep, keep your head still for me. Now I want you to close your eyes. Okay. So this one actually is a really good fit. I am going to just go ahead and adjust the Bluetooth here on that left side because your elf ear is kind of getting in the way there, buddy. All right, so I've got this one measured just a little bit more off-centered, and this one is just right at the end there. Okay, and oh my gosh, my timer is going off. Hannah's going to be here any second, and I'm not even dressed. I really have to go. I have to make it all the way to the Pacific Northwest in the next 4 minutes, okay? I am going to put both of these in your sleep sack, okay? Now I want you to take this with you, and please don't forget to have Santa check you off. Okay. Have fun and be safe. All right, Miss Hannah. This is Sarah coming in. I don't want to startle you as I already have you in the starting position for your session today. So I have you in as a referral. It looks like you actually just saw Dr. Perez a little while ago.
Yeah.
Yeah, okay. So she tells me that you've been experiencing some migraine symptoms. Yeah, okay. So I was just speaking to her to kind of get a general idea of what's been going on with you today. Now, my job as a migraine specialist is more on the kind of therapeutic side of things. So whereas Dr. Perez kind of diagnoses and, you know, does some kind of clinical style testing to see what's going on or to kind of isolate your symptoms, I more so work with different kinds of therapies and different treatments that might help alleviate some of the symptoms you're having. Okay, so the goal for today really is just to get you in sort of a baseline state of relaxation, see if we can, you know, help reduce some of the swelling. So just having you in this position here, I can also see some swelling specifically on this side, and that was noted by her as well. So just to start, I do like to get a bit of an initial kind of gauge for how you're feeling. So firstly, if you can just tell me how you're feeling as a whole. Are you feeling generally well, fairly unwell?
I'm feeling moderately well.
Moderately, okay, all right. And are the symptoms you're having still related to the headache, the migraine? Is it something else that's bothering you?
Yeah, it's my head.
Okay. Now, if you could rate that for me on a scale of 1 to 10 before we start any therapies, 10 being, you know, the very worst pain you've ever experienced, super uncomfortable, and then 1 being very mild.
Probably a 4.
A 4, okay, so it's fairly moderate, but definitely experiencing something. And then I was told that kind of most of your discomfort is here on the right side.
Mm-hmm.
Okay, all right, so I'll be focusing on both sides, but I'll definitely be sure to try to alleviate some of that discomfort there on the right side. And just to give you an idea, Everything is going to be kind of, upper body, so it's going to be very head focused, obviously around the orbital area, around your eyes, and then I might come down just a little bit at the shoulder and see if I feel any displacement or anything there, but for the most part I will be working with your face. Okay? All right. So for this examination, I really want you to just kind of relax for me. There might be some points where I ask you how you're feeling, if you're feeling any relief or if anything's making anything worse, but for the most part I would like you to try to just remain with your eyes closed. Try to relax if you can, and throughout the process you're welcome to tell me if anything is uncomfortable.
Okay.
Okay, all right, so we are going to go ahead and get started. So for this first part, I'm going to do just a bit of a examination myself of the swelling just to see where exactly I need to focus my attention. So just keep your eyes closed for me. You're going to see a kind of dim light shining across your face. I do see some slight pulsation here on the right side. Also noticeable on the left, but certainly not as much. Just gonna shine my light at the center of the face here. Look for any symmetry in the shadow cast, which is not notable. Okay. Definitely a pocket of swelling there that I think we can help diminish a little bit today. Smaller light here, not as bright, but this one is going to go directly over the eyelid, so just keep your eyes closed for me. Still seeing some of that pulsation here. Interesting. Okay. Alright. So I'm going to go ahead and move into some initial palpations of the face. You don't have to do anything here. I'm just going to start by feeling around. Of course, let me know if anything becomes painful or tender. I do feel quite a bit of warmth here at the top of the forehead. It's kind of permeating into the scalp. A little warm around the temporal region, not quite as much. Slight, just kind of blushing of the cheeks there. Just feeling around for any external inflammation. Most of it appears to be kind of isolated here to the lower orbital socket. Some mild compression here, just kind of a gentle, firm pressure. Is that painful at all? Tenderness here?
A little bit on this side.
Alright, okay. So I'm going to go in with some kind of initial cold therapy here. So this is going to just allow the muscle to relax a little bit. So you're just going to feel a very cold sensation. It actually should feel fairly comfortable.
It does, yeah.
Just trying to encourage some of that excess fluid to move away. So I'm going to go down to start, and then I'm going to flush up and out towards the scalp. Now sometimes you can feel a bit of pressure here. It starts to encourage that lymphatic drainage. So let me know if you feel like your nose is running or anything like that. All of that is completely normal. Out towards the ear here. I'm going to go directly along. I know this part is a little tender. I'm just going to encourage some of that fluid to kind of drain out and away here. Checking to see if there's any kind of pockets stuck there, but it does look like we're pretty fluid. It's a little swollen, but it's not protruding or anything, so that's a good sign. Alright. I'm going to do some isolated therapy here. So I'm going to place, I have just a little eye cover here. It's going to cover one side, and I'm going to start with the most affected side. So I'm going to place this very gently over your eye. Does that feel okay?
Mm-hmm.
Okay, I'm just going to allow that to sit there for a minute. And on the other side, I'm going to begin with a little bit of therapies here. So I'm going to pull very gently up on the skin. Very mild air coming here, just toward the base of the lash line. Alright, now you're going to feel a very cold tool on the left side. Very gentle pressure here. And coming directly underneath your eye, keep your eyes closed. And moving out and down. Do that one more time. Very gentle pressure just above the eyelid. And over towards the temporal region. And again, just underneath the eyelid, eyes closed. Doing a sort of pancaking motion here. Out and down towards the lower mandibular joint there. Let my tool cool down before I bring it over to the other side, and so I'm going to go in with an amazonite stone. Now, the stone is very good for inducing a very peaceful, kind of tranquil state of mind. So I'm going to use this here as a bit of a topical application. So we're going to start just above the eye here, and I'm going to hold this down for just a second. It does have some very mild ridging. There's little circular bumps on the side that's making contact with the skin, and this is going to help with very intricate acupressure points here just around the eye. Mild pressure as I come down. These stones are good for energy transfer. It's already becoming quite warm, kind of absorbing the heat that's coming off the surface of the skin, help cool down some of that tension. Alright, Hannah, so I am going to switch eyes here. Same thing, this time we're going to cover that left side. Now your right side might feel just a little more sensitive at the moment because it has been covered from the light, so just going to repeat the same therapies here. So you're going to feel a cold tool, very gentle pressure here, again coming down towards the temporal region where I do see a little bit of swelling, so I'm going to hold this in a downward motion and just move in very small circles here to help further encourage some reduction of that inflammation as I come down towards the orbital socket. Just be sure to keep your eyes closed for me. And down again towards that lower mandibular joint there. I'm going to do that again on the right side because I still do see just a little more swelling here. Smooth pancaking motion here. Coming in with another Amazonite stone, same thing, it has the nice ridging here. I'm going to just very gently hold down and help relieve any further inflammation, just inducing that relaxing state of mind. I find it particularly helpful here at the temporal region. It fits in quite nicely. And again, coming down. So I'm going to uncover that left side. And I'm actually going to use both of the stones at the same time. So I'd like you to just again keep your eyes closed for me. Coming in directly above the brow bone, I'm going to hold firm. Just breathe. This might relieve any kind of sinus pressure that you have, so just breathe for me. I'm going to come out, very gentle, kind of smooth motion here, holding at the temporal region. You're going to feel me move around slightly here, just jostling the stones, ensuring that we're utilizing those bumps to do some very gentle acupressure here. I find it particularly helpful right underneath that orbital socket. I'm going to leave those there for just a minute. You let me know if the weight and the pressure is too much. Just going to come in and do some very mild tension relieving techniques at the hairline. So oftentimes if we're getting migraine or headache symptoms, very, very gentle tugging at the follicle can help. Just allows blood to flow beneath the space of the hair and the skin. So Key is to just very mildly tug here. We're not pulling. It's almost like a stretching of the skin. We'll hold pressure here just below the base of the ear. Alright, I'm going to give our students a break while I move forward with our therapies, and I think I'll go in with our jade rollers here. So you're going to feel some pressure at the scalp. It shouldn't cause you any pain. Just encouraging movement. I'm going to hold here for a second. And again. And hold. And again. And hold. A few more times here. And holding directly at the temple now. And hold. Good. Now switching to jade stone. I'm going to use this to trace along the contours of the lower part of your face. Very good. Should feel me touching you here at the shoulder. Just sensing for any excess pressure here. Let's look a little bit better there. So I think what we need is I'm going to have a look at the scalp a bit more. So I've got a jade scratching stone here, and I'm going to use this at the very base of the hairline. Now it is pointy but rather blunted. It shouldn't feel particularly sharp, but you will feel just a sort of nail scratching sensation, and this is going to help just further relieve any tension here at the scalp. I'm going to guide this back.
Feels so nice.
Good. I do find this really helpful for my clients who come in with headaches. Just the kind of sensation along the scalp does tend to help relieve a lot of that pressure. Also provides just a nice kind of sensory experience here, which is rather relaxing. and mimic on the other side with my hand. Very kind of swooping motions down and away. Very gently along the eyebrow. I'm going to hold the balancing stone here at the middle of your brow, and I want you to just breathe. Alright, Hannah, so I'm going to come in with a little bit of a gentler approach for this next portion, and you're going to feel a very soft sensation on both sides. Now it is different on either side. Just offering a different source of stimulation, following along these kind of linear meridian patterns that you have in your face. I like to go along your natural bone structure, so if we start at the bridge of the nose and trace across the brow bone, coming down towards the temporal region and underneath the orbital socket, following down that mandibular joint just at the lower cheek, out and away towards the base of the ear. I'm going to do that a couple times. Very fluid motions here. Tickle just a little bit.
It's nice though.
Following down the very natural indentation of that mandibular joint. Now this time I'm going to go up right near the ear, and I'm going to hold here. And just along that lobule. And hold. Right over the eyelid here, very gentle sweeping. And I'm going to finish just a little tickle here. It just helps encourage some of that nerve movement as we move into our next more very specific sensation that you will feel in just a second. Alright. So for this one I'm going to do a more focused kind of lower face. You're going to feel some sharp sensation. Now it shouldn't feel particularly sharp or painful.
No, it doesn't.
It will just allow me to further encourage some of the movement of that fluid here, as well as just offer a little bit of relief. It is also fairly cold, which tends to feel quite nice.
Feels great.
So I'm working towards the ear. help increase blood flow, which tends to kind of encourage the body to heal a specific area. Just feeling for where you need anything specifically. Down here.
Feels like little tiny feet.
Kind of, yeah.
How to explain it?
Because there are so many ridges and they're so close together, the surface tension isn't quite as, severe as just one needle in particular, so it does provide kind of a nice...
Feels great.
Feel just my hands here along the scalp. Just going to do some very gentle compression as I kind of hold down here. Use my thumbs to press directly in the middle and hold. And release there. Good, okay. I'm going to bring your head up and back for just a second here. Okay, so we need to pay a little bit more attention. Okay, so go ahead and go back down for me. I'm going to bring our flat tool back in here. So just relax for me. Hold here. Very good. I'm liking that quite a bit, actually. I'm going to leave that there for just a second. Find that the combination of the pressure along the facial chakras as well as the stimuli along the scalp can provide a nice variation. holding here. And holding on the left. Good. Provide some bilateral, very identical stimulation here. As the notes I read from Dr. Perez said, it looked like you were having a little bit of differentiation and sensation in your ability to perceive things. So I find that applying identical pressure and stimulation to both sides can encourage the neurological functioning and kind of reminding your sensory perception to perceive things normally. So doing my best to apply identical pressure here. Does that feel the same to you on both sides?
Mm.
Good. Okay, so that is an improvement. Holding here. And holding here. Good. One last point at just at the base of the temple here. And good. Alright, and I want you to kind of slowly open your eyes for me. Might take a minute just to adjust a little bit. How would you say you're feeling right now?
I'm feeling great, very relaxed, no pain.
Good. Okay. No pain. So we were above 4 before we started the session. How would you rate your symptoms now?
A 1.
A 1. Okay, perfect. Well, then mission accomplished. It looks like we were able to not only relax you, but provide you with some relief from those migraine symptoms that you're having. Now, I do agree with Dr. Perez. I think it would help to obviously prioritize rest if you can. 8 hours of sleep obviously is ideal. If you're needing to nap throughout the day, that is okay as well. I would also try to minimize electronic use as much as you can, and any of these therapies that you found relaxing today, you can also implement at home. Okay, so I would definitely, look into kind of prioritizing your health and what is going to make you feel better as far as longevity. And, when we think about wellness, it's not just in the moment, but long term as well. And I know you work on your phone and on a computer a lot, so it is important to kind of implement some of these things. So
I'll try.
all right, it's the best you can do is try.